Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is December 7, 2025. This video is on a JAMA article published online on December 1st, 2025, last week, titled WHO Guideline on the Use and Indications of Glucagon-like peptide 1 or GLP-1 therapies for treatment of obesity in adults. What is WHO's definition of obesity? It's a chronic relapsing disease requiring lifelong care, early diagnosis, and management of comorbidities. Why did the WHO issue these GLP-1 guidelines? It was on the request of the member states. They requested an evidence-based guidance addressing the rising global obesity prevalence and the unmet treatment needs. What are GLP-1 therapies? They are medications that reduce appetite, enhance satiety, and improve metabolic outcomes originally developed for type 2 diabetes. Who are these guidelines intended for? Non-pregnant adults living with obesity requiring long-term care, integrated approaches, and equitable use or equitable access to therapy. What is meant by long-term use? Continuous treatment for greater than 6 months following current regulatory definitions. Why are the recommendations conditional? The benefits are clear, but uncertainties remain regarding long-term safety, cost, equity, and system readiness. Do GLP-1 therapies work without lifestyle changes? Yes, but WHO recommends pairing them with intensive behavioral therapy for sustained benefit. What does intensive behavioral therapy IBT include? Structured exercise, dietary restriction, weekly counseling, and routine progress assessments. Which GLP-1 agents were reviewed? Liraglutide, semaglutide, tirzepatide, assessed individually and as a class. Why did WHO consider GLP-1 therapies as a class? Evidence across agents showed broader similar efficacy for obesity management. What comorbidities benefit from GLP-1 therapy? Cardiovascular disease or heart disease, kidney disease, sleep apnea, high blood pressure, steatohepatitis or fatty liver, and neurodegenerative disorders. Why is the equity a major concern? The production capacity for GLP-1 therapies covers less than 10% of the global need, and high costs threaten fair access. What health system changes are required? Training, strengthening of the supply chain, chronic care platforms, digital tools, and universal coverage mechanisms. Will generics improve access? Yes. Patent expirations, example semaglutide in 2026, may enable generic production and tiered pricing. How should countries prioritize therapy access? Using transparent, risk-based frameworks for individuals with greatest need. Do GLP-1 therapies replace lifestyle counseling? No. Counseling remains essential as the first step before and during medication use. Do the guidelines address dose titration or discontinuation? WHO notes insufficient evidence and highlights ongoing research needs. Are GLP-1 therapies part of WHO's essential medicine list? Yes, for high-risk individuals with obesity and cardiometabolic disease. Why must obesity care be person-centered? To reduce stigma, ensure dignity, and align therapies with individual priorities. Can GLP-1 therapies shift global obesity trends? Only within integrated systems, combining prevention, chronic care, and equitable access. What upstream determinants must be addressed? Food systems, urban design, economic inequities, and commercial drivers of obesity. Why is prevention still essential? Medication alone cannot reverse global trends. Societal and environmental drivers must be addressed too. What research gaps remain? Long-term effects on kidney disease, cognition, addiction, and quality of life, and predictors of treatment response. What programmatic steps matter most now? building delivery readiness, expanding supply, and developing equitable prioritization pathways. What is the broader vision? A global, fair, integrated obesity care ecosystem driven by prevention, innovation, and equity. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.